Okay, hi everyone, and welcome back to Healthy Living. You can reach me at healthyliving.company. There's my website. I have my previous shows you can watch anytime. Also, there's products. There's Keita's egg toast and gumbo. But if you want those items, you have to contact me and send me a message. You can also contact me here at the Next Level Studios at 310 549 1113. 310 549 1113. Now, if you want the gumbo, you have to let me know because it comes with rice and hot water cornbread. Also, the T-Jams is TJAMZ, and you can reach him at tjamsmusic.com. There he has a whole list of different songs you can write lyrics to. You can send him messages there. You can also contact him at the Next Level Studios, 310 549 1113, 310 549 1113. So, now, what I want to talk to you about is the coronavirus. Don't let your guard down. It's not over. We have virus mutants that are happening that you guys have heard about. I get my updates. I get my information from the CDC. I get my statistics from the World of Media website. That's how I get my numbers. Also, I get stuff from the World Health Organization, the WHO. So the current numbers for the coronavirus, now this is worldwide. I can't believe this number is staggering. It's 103,425,328 cases. Now, the actual deaths are still astounding. It's way too many. It's 2,235,179. That is absolutely terrible. There's a small glimmer there. We do have a lot that have recovered. We have 75,113,644 different individuals that have recovered. Now, the U.S. is the leader in cases and deaths. So the U.S. has 26,736,228. Deaths is 451,540. This is way too much. Now, Brazil is leading third in cases, which is 9,184,112. But they're leading second in deaths with 244,124. This is just outrageous. Now, for you, I'm pretty sure you know by now, the World Health Organization declared this a pandemic March 11, 2020. So anyway, it started to December 2019 in China, Wuhan, China. At first, this is a new virus, so it should have been considered airborne, but it hasn't been. But now they finally caught up and said it's airborne. It causes severe acute respiratory syndrome. The virus is also a beta coronavirus like the MERS, the Middle Eastern Respiratory Syndrome. Also, these viruses, they all came from bats. The outbreak from Wuhan, China didn't quickly spread to the U.S. At first, they thought it was animal to person, but then they quickly discovered it was actually person to person. So that's how it got spread throughout all the U.S. and international and all the different destinations. And this is where we are today. Now, the symptoms, they vary. You might have, it's kind of flu-like symptoms, so I don't want you to discount the symptoms. They include fever, at least 100.4 or more, fatigue, cough, shortness of breath, chills, repeated shakes, and from what I have heard, they're pretty painful. Sore throat, nausea, vomiting, diarrhea, congestion, runny nose, a new loss of taste or smell that you never had before. So don't discount the symptoms. Now, there's more severe symptoms that you need to contact 911. Don't wait, don't hesitate. If you have trouble breathing, persistent pain in your chest, new confusion. If you start changing colors, depending on the pigment of your skin, it can be it could be blue, it could be purple, and it could be gray. So don't hesitate to call 911. Just let them know your symptoms and they will come prepared. If you think you have these symptoms, persistent pain in your chest, just contact your primary provider. If you start changing color, you want to make sure that you contact them to let them know what's going on with your symptoms so then they can direct you. Now, the people that are more vulnerable, of course, is the ones that are 65 and older. Also, there's people who have comorbid diseases. So they are at severe risk at this time for more hospitalization, ICU, and intubation of the ventilator, and then possible death. So we want to make sure that we protect these individuals. Now, the conditions that we're going to talk about is heart disease, hypertension, chronic respiratory lung disease, asthma, COPD, chronic pulmonary disease, obstructive pulmonary airway disease, chronic kidney disease, sickle cell anemia, cancer, autoimmune, suppressive diseases like HIV, leukemia, cancer, post-chemotherapy also subjects you to more susceptibility. Diabetes type 2, more than one. Not sure why in the research, but they say 2 is more of a problem. But just remember that. Also, smoking, pregnancy, and obesity. So everybody is vulnerable. Now we have the children. They have what they get is a multi-symptom inflammatory syndrome, which is kind of like the Kawasaki disease. Also, there's been recent history where children with asthma suddenly die. So parents, please monitor your children because they're dying also. Now, the Kawasaki disease was found back in April 26, 2020. This was in the UK. This is also now where the variant is coming from, UK, South America, and then also South Africa. Now, what happens with these children, they get these symptoms. It's like Kawasaki disease. They get fever, diarrhea. They get the body rashes. A lot of times with children, when they have fever, they get body rashes. So, and then also the rashes are on the palms of their hands, on their feet. They get a swollen tongue. It kind of looks like a strawberry type effect because it swells up. There's redness in the eye, but no crust, no drainage. So it's like pink eye, right? But there's no drainage. So you have to watch them because there's a lot of problems. They get joint pains. It causes inflammation of all the major organs, including the heart. And so children are dying now. So you have to really pay close attention to your children. Now, per California Department of Health, immediately after COVID vaccines were authorized or approved for the FDA, the supplies is insufficient. We know there's not enough for everybody. So in order to make it a fair assessment of who gets what vaccine first, they have, we get vaccines. The names of the vaccine currently are the Pfizer and the Moderna. Now, we also have some pending new ones that are coming, the Johnson & Johnson and the Norvax. Those are coming. So they're finishing up their trials so that we can start having access to those vaccines as well. Now, the Johnson & Johnson, they're a single dose. And they said their vaccine provides 85% effectiveness global against the severe COVID-19 illness and 72% against moderate to severe illness in the U.S. Now, according to highly anticipated phase 3 results, efficiency against severe disease provided by Johnson & Johnson vaccine held true. Now, race, ethnicity, absence or presence of comorbidity. So it's withstanding that they sampled 44,000 studies in this particular situation. Study conducted in the U.S. and South America and also South Africa. According to the CDC website, though, the facts about the COVID mRNA vaccine, now it's important to note that the COVID vaccines do not have coronavirus substance in it. It has the mRNA. mRNA does not include or contain any forms of the COVID-19 virus. The mRNA vaccines are a new type of vaccine to protect against infectious disease. What it does is it triggers your immune response. Many vaccines put a weakened or inactive germ into your body, but COVID vaccine does not. This does not, I'm going to repeat that, it does not have COVID in it. It has the mRNA. That's what they use instead. What it does is it helps to teach our cells how to make proteins, or even just a piece of the protein that triggers the immune response in our bodies, right? So the immune response that produces antibodies, in which protects us from getting the infection of the COVID virus. So the COVID-19 mRNA vaccine gives instructions to our cells to make a harmless piece of what is called the spike protein. You know, you've seen the pictures of it. It has those ugly little spikes all on them, right? You've seen the pictures of it. The spike protein is found on the surface of the virus that causes the COVID-19. So COVID-19 in mRNA vaccines are given in the upper arm. Now, I had mine too. I was reluctant, but I did a lot of research. And the reason I was reluctant because I had severe allergies to cats. Now, I want you to consult with your doctor, because my doctor told me as long as you haven't had an anaphylactic reaction, it's okay for you to get the vaccine. So I'm proof in the pudding. I got mine on Friday. The only thing I have is a little soreness at the site. So you're okay to get your vaccine. Once the instructions of the mRNA are inside the immune cells, the cells use them to make a protein made in the cells to break down instructions to get rid of them. So this is how it fights it off to help keep you from getting it, the COVID coronavirus. You don't want that anyway. The next cell displays the protein piece on its surface. Our immune system recognizes the protein does not belong there and begin to build an immune response and making antibodies, like what happens in natural infections but this will be with the coronavirus. That's what this new mRNA is for, to help us develop that reaction so we can fight against the COVID. Now, at the end of the process, our bodies have learned how to protect against future infection. The benefit of the mRNA vaccines, like all vaccines in their vaccines, gain the protection without even having the risk of serious consequences of getting COVID-19. So the vaccines will not give you COVID-19 because it doesn't have products of COVID-19. So I just want to make that very clear. Researchers are studying and working with NRE vaccines. They've been doing this for decades. It's nothing new. Even the flu is a form of corona. So we've had a lot of different coronaviruses. So it's nothing new. So they know how to work with this, and they develop it in laboratories using ready available materials. This means that the process can be standardized and scaled up, making vaccine development faster than the traditional methods making vaccine. Now, the mRNA vaccine have been studied before, the flu, the Zika, rabies. Like I said, this is not new, the coronavirus. So as soon as necessary information about the virus can cause COVID was available, the scientists already knew how to jump on top of this. And this is when they designed the mRNA instructions for the cells to build the unique spike protein into the mRNA vaccine. Future mRNA vaccines technology may allow vaccines to provide protection to multiple different diseases, thus decreasing the number of shots needed for protection against common vaccine preventable other diseases. Like they're working on vaccines for cancer research. Cancer is ongoing. So mRNAs could trigger immune to target specific cancer cells. So they're always working. So this is nothing new for scientists. Now, let me tell you about when you're going to get your vaccine, the different type of people. Now, In the first phase, there's going to be vaccinating about 3 million people. Actually, it's about 7 million healthcare workers that they need to vaccinate around the world. Also, the long-term care residents, meaning the nurses like myself, we go to homes, we interact with possible people, we take care of patients in the hospitals and different places. We have to be vaccinated so we'll be there and available to take care of you if you do come to hospital and you need our care. So we're one of the first long-term care residents, the ones that live in convalescent hospitals or assisted living, where they're congregated settings, meaning they several number of clients stay in one space. They have to share the same bathrooms and they share the same lunch and cafeterias. So those are the ones that are the smallest population, but they've died 33% of the time. So that's why we have to protect them. Now, after that, it'll go on to vaccinating approximately 8.5 million individuals. Now, if you're 65 and older, you can get your vaccine as well. So please contact your local, you call your primary. They can direct you as well. I went through my Kaiser provider to get my vaccine. So there's different ways. There's your primary, there's your HMO, and then there's your county availability sites that you can also schedule appointments for your vaccines. So 65 and older, education and child care, emergency services, food, and agricultural. That's how we eat, right? They get our food and then it comes to the market, so they got to be protected too. Now, after that, those who are risk to exposure and working in the following sectors, like transportation and logistics, industries, commercial, residential, and sheltering facilities and services critical to manufacturing, like making our other products that we need to eat or care for ourselves in our day-to-day living. Congregated settings with outbreak risk, like incarcerations, inmates that are in prisons and jails. The homeless. Homeless is always a high priority, so they're trying to get as much as they can, get them done, because they're at risk and an increased risk to everybody else. Now, the other one at the end is like individuals that are 50 to 64 years of age, people 16 to 49 years of age who have underlying health conditions or disability which increases their risk to COVID. Those at risk for exposure at work sectors. Now, you have to be working. My sister was a little disappointed because she qualifies, but she doesn't work. At work sectors like water and water waste, defense, energy, chemical and hazard materials, communication and IT, computer network finances, financial services, government operations, community-based essential functions. So that's just so you have an idea of when you fit into the time frame or when it's time for you to get your vaccine. But the news is very good at keeping you abreast of when and whose time it is to get the vaccine. So I want you to pay attention to that. And if you fit those categories, especially now, healthcare workers, if you're in a convalescent home or if you're 65 and older, you need to go and make your appointments as soon as possible. The process is very easy. I got my injection. After you get your injection, they schedule you 3 weeks later for your second injection. So you leave away there with your appointment. So I just wanted you to know that. Now, according to Medscape article by Carrie Young on January 29th, Dr. Fauci sees this is a wake-up call for emergency virus variants. They're changing. The new data from the coronavirus vaccines are served as a wake-up call, he says. And this is why I tell you this is not time to put your guard down. You have to keep wearing your mask, social distance. Remember I said months ago that the virus can travel up to 22 feet in 90 seconds. So you need to keep as much space as possible as you can and wear your mask. Even Dr. Fauci is recommending wearing 2 masks. If you have a K95, get you a K95. That would be better. We as healthcare workers, we have N95, and I will go over that and show you the difference. Now, Among people, thus the opportunity to evolve its defenses. The top federal experts on infectious disease says the virus will continue to mutate. That's what it does. It's just like the flu. Remember how the flu every year it keeps changing as well? That's what this is going to do. Why? Because this doggone virus wants to survive. So it keeps mutating, trying to fight. So we have to do the same thing. As it mutates in different sectors, advantage, says Dr. Fauci, the director of the National Institute of Allergy and Infection, on Friday at the conference that was at the White House. Continue to transmit the SARS gives the virus a chance to adapt their own forces. In the case of immune response, that's trying to get rid of it. Dr. Fauci says that you get mutation. Federal health officials working on a boost for the U.S. supplies for the COVID vaccine, even as a single emergent about the extent that the virus is already evolving. Now, they said that the new variant is more contagious. Now, it's more contagious, meaning you can get it faster than the old variant. So you still got to stay protected. It's not the time to relax. Data released this week about the Johnson & Johnson and Novavax coronavirus is late-stage development, provides further evidence that may protect us well against the emerging variants. Dr. Fauci said mutations that lead to different linkages to have clinical consequences, saying will also emphasize that the emerging vaccines appear confident of broad protection. Dr. Fauci in early days addressed messaging changing for clinicians and researchers to discuss the results of the J&J vaccine trials, which appears to fall short from those reported of the other two vaccines already approved in the U.S. He noted benefits possibly soon have more authorization of vaccine to combat the COVID-19. But continued community spread of the infection will foster conditions that undermine the vaccine's effectiveness. Even though long-range effects of the sense of urgent, the severeness of the disease still handles reasonably well by the vaccines. So some protection is better than no protection. So please still get your vaccine. Pharmaceutical and sciences and executive and governor and health officials will need to work together to develop the vaccines, the ongoing vaccine, just like the flu vaccine. We have to keep changing because it keeps changing. So we're going to keep working on that. On Friday, Johnson & Johnson reported that it's highly anticipated the single-dose vaccine it didn't work as well in South Africa, where many cases of COVID were due infection of the SARS variant B.1.351 linkage. Only about 65% globally, 70% and 72% in the U.S. and 57% in South Africa against the moderate to severe coronavirus. Johnson & Johnson and Novavax on January 28th reported the efficiency rate of the COVID vaccine of 49.4% from the clinical trials conducted in South Africa. You know, that's where that ugly new mutation is. And compared with the 89.3% rate from the UK study. There already have been attempts to estimate how well the Pfizer and the Moderna will do. Vaccines can handle new variants of the virus. They both have been granted emergency authorization for the use through the U.S. Food and Drug Administration. This is why we have the vaccine now. Now, genomic surveillance, the Center of Disease Control, that's the CDC, on Thursday reported that the U.S. documented cases of that mutant virus, the B.1.351, in South Carolina. On January 26th, the first confirmed U.S. case of the highly transmitted Brazilian corona variant was detected in Minnesota state, health officials said. Now, CDC stepped up genomic surveillance when they help keep the clinicians and researchers aware of how the SARS COVID-2 is changing. Dr. Fauci is talking about this, speaking during the White House conference. Now, CDC Director Rochelle Walensky MDMPH says the 2 South Carolina cases of the B1.351 variant was reported in different parts of the state and not believed to be epidemiologically linked. The people involved did not have to, they didn't even travel. So they're not sure how this is happening. So they didn't travel to Africa or the UK. So this is very disturbing. The SARS-CoV-2 mutations were expected to emerge at some point. We knew it was coming right when we heard it. We didn't want it, but we knew it was coming. That's why you have to keep protecting yourself. So people remain vigilant, and you have to have the precautions to stop the spread. You have to keep protecting yourself. I know you're tired, but you can't stop now. We can't. You have to keep the protection going. Both her and Dr. Fauci both stressed the need to continue to use masks and social distance, urge people to get the coronavirus 19 vaccine as they become more available. Continued community spread of the virus allows this global health threat to keep replicating, getting bigger and bigger, right? Aren't we tired of hearing about deaths? You have to protect yourself, thus increasing the chance of all of this happening. And I know all of us have experienced co-workers, friends, and family members that have died. And also remember, when you gather outside your household, you can bring it back to your whole household, and several of your family members can die. So you want to not group outside your household. You want to stay within your group. This is not the time to party. And I know you miss your friends and your family, but this is not the time. Think about that. You don't want them to die. So the journalist is based from Washington, D.C., said earlier to cover the policy, federal budget, and congressional quarterly CQ roll call and pharmaceutical industry in the U.S. Food and Drug Administration. This is where this is coming from. So this is what I'm going to tell you. I want to show you the differences between the masks, like I had said to you I would do. So I'm going to show you. There's different types of masks. There's also different types of goggles. Now, I did a show on eye protection, which is very important. You need to wear goggles as well. Now, this is what they give us at work. These are kind of blurry, but there are some online that you can get that are fog-free, that don't have the vented areas, because you don't want the vented type. You want indirect or no vent. So this fits very firmly on your face to give you eye protection. Now, we have, as medical staff, we have a fitted N95. This means we're fit tested, so it fits our face. So this is what we have and that we work with when we work with patients. It fits very snugly. You use your fingers to make sure it fits, and it fits snugly around your face, not to let any air in. Also, there's face shields. So you can have a face shield and put it on, right? It's another layer of protection. Now, if you don't have this available, if you're not a healthcare worker, there's another option, and it's called a KN95. And it has the nose bridge here that you can adjust. It has the two straps you can put on, right? You put it on. So it fits, and you take your fingers and you press on the side to make sure you have a good seal. So it closes and encloses your face so that there's less air coming in. It also, what makes it so cool about whether it's K or N95, the material that it's made of helps to filter those bacteria and germs away from you, so you don't get it into your face, in your nose, and your mouth. That's why these are so good. So You can order these online. They're more available. So order you some KN95. Those are better. But if you don't have it, there's other things. Dr. Fauci has recommended that you wear 2 masks. Now, if you have a KN95, you can put it on. And then you can also put a cloth mask over, if you want, to help keep your N95 clean. These are washable, right? The cloth. If you don't have that, you can put on 1 mask. Say, for instance, you need to make your mask. Okay, so if you need to make a mask, all you need is a piece of square material. You can cut it off the bottom of your t-shirt, so even if you don't have the money, can't afford it, just get you a square piece, fold it in half, and then you take the bottom corners, fold it towards the middle, and the same with the top. You take either rubber bands or elastics, spongy, rubber bands we put on our hair, ladies. Or you can use rubber bands. You put them on each end, right? Put them on each end. You fold the material inward. Depending on how big you need it to be, depends on how far you fold it in. And you grab the rubber bands on each end, and you have a mask. Right? So you have to make sure that it covers your nose and your mouth. Now, if you don't have the N95, you can put on a second cloth mask. For extra protection. So, now you have ways to make a mask and have extra protection. You can even do, say for instance, I ran out and I forgot, and you could make your mask. Well, you can't. You can go to the bathroom and get you a couple of paper towels, right? Same thing. You fold it down on each side. You do the same thing with the rubber bands or the elastic crunchy on the end. Fold it in. And you still have a mask. Right? Hold on. So you still have a mask. Okay? So I did that one time when I went to my doctor's appointment and 2 of the girls didn't have a mask on. So I made them a mask for my safety, right? So there's no reason why you guys can't be protected. Now, the goggles, you can get the ones that are fog free. If you wear glasses, you can get the kind that fits over the glasses. These are both fog free and they can fit over your glasses. So you can order these online. So you can protect yourself. Okay, here's your glasses. And you still have that protective layer here. So those are the kinds you can get. If not, then it's secure close to your face. Now, also, in order to take care of yourself, I want you to know that you should be eating things that help you with your immune, like blackberries, avocados, cashews, almonds. Those things help to build your immune. You can also take garlic, or you can eat garlic. Also, there's zinc. You can take zinc products. Avocado is for both. And far as the coronavirus doesn't like acid, so lemon, oranges, pineapples, even avocados. That will help you with that. So also vitamin C, also melatonin to help you sleep at night. It also helps you, and fiber. So we're going to take a break, and when we come back, then I'm going to show you some exercises you can do to stay healthy, because you don't want to gain weight. You want to lose weight to help improve your ability to survive. Okay, so I'll see you in a few minutes. Okay. Okay, so welcome back. I'm going to show you a few exercises that you can do while you're sitting, while you're lying, and while you're standing. Okay, so if this is your couch or your bed, you put your back up against the arm or your backboard, and you can go up and down. Always hold your abs in, right? Then you can slide down when you get a little bit stronger. Do the same thing, and you do 3 sets of 10s. Okay, if you're not used to exercising, because you're gonna feel it. And then when you get more advanced, you go all the way down. You always hold your abs in. That's very important to hold your abs in. Okay. Now let's continue. These are exercises while you're lying still. You can use resistance band. If you're not used to exercising, you can use it to help pull your legs up to exercise if you need to, so you get used to it. Or if you don't, then you can do it all on your own, and you can lift up and down. You can do it together. Remember, always hold your abs in. I'm tying this band together to show you something different. You can put this band on your leg, and you can open and close. A little more resistance, you can do that with the band. Also with the band, you can put it over your knees, and you can turn to the side, where you can do lifts, leg lifts. Make sure that your hip is rolled all the way over. So I usually make sure I put my hand here, my hip is over. Then I can lift, and then do 3 sets of 10s, right? Then you can stretch your leg out. You can do 3 sets of 10s, right? You could go to the back. Remember, roll that hip over and do 3 sets of 10s. Or you can hold it for 30 seconds. You can do that as well. The main thing is to get the going, exercise. And remember, do it both sides, not just one, both sides. Now, let's do some more. Where you're on your back. So, remember, always hold your abs in. So you can lift your legs one at a time. You can lift them at the same time. You can go little to middle, higher, hold your ab in till you go all the way, right? So these are good ones you could do. Now, another thing you could do for this inner thigh right here, the one that hangs and rubs when you walk, that's what this is for. So, open and you close. It's for that inner fat thigh, right? Now, another thing you can do is to go to the side, whether it's little, moderate, or more, till you get here, right? Now, this is for that, you're gonna feel that inner thigh right there. So that's for this part too. You can hold it as well, even at the end of your exercises, because it's a good stretch for your back. And remember, do both sides. Don't just do one, do both sides. Now, another thing you do when you get really good, you can do 2, where you go with both legs until you can go all the way, right? So, you do where you can go with both, hold your abs in until you can go both. And then remember, go both sides. This is for those love handles right here. That helps take care of that. So, that's good for that exercise. I used to have all kind of tire rims. Okay, so this helps to exercise. That helps that, okay? Now, you can do scissors, right? Hold your ab in. Now, there's another one that's good for the butt and the back fat and the back of your thigh. Like moon craters, you know how you have those holes in the back of your thighs? Okay, you can do this one. Now, if you have problems with your knees, then don't go all the way. Go where you can go and if you can't go all the way, then go all the way. So another thing you can do is hold it and go back. That causes more resistance instead of going all the way down. Or you can go almost all the way and then come back. Okay. Now, let's do some things we can do while we're standing. So, and trust me, you're going to feel it. Now, there's one thing you can do. You can do squats. Okay, so I'm going to show you in the front so you can see. I'm going to show you two methods. You can do it if you have knee problems. When you stand apart, then you got to sit down squats, meaning stick your butt out, because then that takes the pressure off your knees. So you would have to see how that shift. That takes the pressure off your knees if you have knee problems. If you don't, then you just go straight down. Right? So we have it. Now, one thing I want to show you, because I want you to get your core strong. Your core is your stomach and your thighs and your buttocks. And the way to do that is to be able to hold yourself on one. So you're activating your thigh, your buttocks, and your abs. Now, if you're not there yet, hold on to something sturdy, so you can, in case you can't do it for that length of time until you can do that, because that helps to make your core stronger. So you can do that. Now, another thing you can do, I used to do this when I brush my teeth. You can do little toe lifts, right? Or you can go all the way. All the way. Those are better. See how it activates your calf? That works your calf and your ankle. So you can do that. You can hold it. And if you can't do it yet, then hold on to something until you can. Because I couldn't do it at first either. So just get going. And if you can't, you can start with the little ones and then get to the big ones. Because you want to go eventually all the way and not just the little ways. Okay? So that helps your core. Now, the other thing you can do leg lifts for the side of the thigh. Right? So you can do little lifts, you can go all the way. And remember, you got to always hold your abs in. And you want to do both sides. Don't just do one, both sides. 3 sets of 10. Now, remember I said you can do sit-ups whether you're sitting, standing, lying. Okay, so these are the standing ones. So if you have back problems, you want to make sure you go slowly so you don't have back spasms. So, open your legs and you want to go straight down. If you can't go all the way to the floor, go to your knees, to your calves, your ankles, your top of your feet, so eventually you get there. So wherever you can go, go. Right? Took me a while to get there too. Then you can mix it up and go to the side. Okay? Same thing. Go to the side. So you're mixing it up. Middle. You're doing the side. Do this. Remember, if you have back problems, go slowly. Don't go too fast. Okay? Now, another thing you can do, you can march. March in place. Get you some weights. Go higher. If you don't have the weights, don't worry about it. Get you some bottled water, right? Get you some canned vegetables. It don't matter. As long as you're moving, it don't matter. So you need to do at least 45 minutes to an hour every day, if you can. Now, if you're not used to moving, you might have to take a break for a day, but get back on it, okay? Now, let's do some things that we can do while we're sitting. Okay. Now, before we sit down, another thing you can do, you can hop on different legs and change direction. That also builds your core too. It's like a little dance step, right? Hey, get your arms involved. turn on your music, right? You can do that too. Okay, now let's do some things you can do while you're sitting. Because remember I told you lying, sitting, and standing. Okay, sitting. Now, let's get back to the sit-ups, right? We're sitting down. Now, this may be easier if you have problems with your knees because there's less weight to worry about because you're sitting. So, you can still do the same thing. Go down. You want to get your arms involved too, right? Then you want to go to the side. You don't want to twist. You want to reach to the side. You want your body to move to the side, right? And then this is a good way to unwind when you're at the end of your exercises too. So, now, also, since we're here, same thing with the inner thigh, right? Now, if you want, you can put the resistance band on to give more resistance, and then you can open and you can close for this inner thigh, right? Okay. Now, another thing you can do is toe marches. You can get your weights involved, so you can do, meaning that you're lifting up on your toes. That's what you're doing, which activates your calf as well. So you can be doing that, and you can be moving your arms while you're doing those things, right? Now, you can also do leg lifts. Lift up, then you can do 2 at one time. You can do where you lift like 3 or 4 points. You lift up, stretch it out, bend it down. Lift it, stretch it, bend it down. You can do those as well. So lift it out, down. And it does work. So you do get tired. Now, the other thing we can do good old scissors, right? You just go, just crisscross, right? You can do that, right? So you can do that too. So there's a lot of different things you can do. Now, what else I want to show you is my little buddy. So my little buddy is what you call a cube. Man, this is just a perfect little buddy. And what it does, it tracks how far you go. You can have, there's a resistance knob here, so you can change the resistance to make it harder or less. While you're watching your favorite show, you can be pedaling on your cubie. You can be using your weights or your water. You can be doing that. Now, if it's too close for you, then, if it's bothering your knees, you can move it out a little more, which causes less pain on your knees, on your joints. So depending on what's going on with you, you can do that, and then you can adjust it. Like I said, the resistive part, it makes it tougher. So you can do that as well. So this is what you can do while you're watching Power or, whatever your favorite show is, CNN, whatever. You can be, before you know it, after about maybe 3 commercials, you've done about 30 minutes. And then before you know it, after that, you've done an hour. And you're pedaling. You don't even realize that you're still pedaling. So if you don't get a cubie or, get some kind of little peddler, they have them on the market, and just start pedaling. So then you're exercising every single day. It's good for the kids too, because there's a lot of kids that are overweight as well. So get your kids involved, right? So you want to exercise, you want to lose weight and not gain weight. So when you're stressed out, you want to grab you some fruits, some vegetables to snack on, or you want to exercise. If you're used to overeating, drink a glass of water first, a whole glass of water, including your kids. Sit with your kids while you're eating. Drink a glass of water first. Make sure you give them the proper portion so that they don't overeat. Also, make sure you're not eating too fast, because if you eat too fast, you're going to eat 3-4 times the amount of calories that you should, and then you'll be feeling like, oh, now I'm sick, right? Because you ate too much. So slow down. Slow is better. Eat nice and slow, chew it up really well so you get all the nutrients. And make sure 50% of the plate is fruits and vegetables, okay? That's how you do that. Stay away from fried food. None of that dollar any size, a big old drink that you can give for. Stay away from sodas. Now, if your child is already overweight, you want them to eat their fruit. Give them apples and oranges to eat instead of the juice. So eat their fruit instead of drinking their fruits. So you got to get away from those sodas. And if you're drinking sodas, you can't drink sodas and tell your kids they can't drink sodas. So you can't drink sodas either. And you get the food, so stop buying the sodas. Stop buying all that cookies and cakes and all of that. You buy the food, now there's no excuse not to get healthy things because you got Instacart, you got Amazon groceries, Amazon Fresh. You got everything that you can order food to deliver to your door. So there's no excuse anymore about there's no markets around. It's right at your fingertips online. And it's safe because you're not going into the market. So remember to wear your mask whenever you have to go out. Remember, you should only be going out for essential things. Only essential things. If you don't need to go out, don't go out. You cannot gather outside your household because the variant is there and it's more contagious. So this is not the time for us to sit back and say, hey, I can relax. The vaccines are here. I can relax now. No, you can't. You have to be more vigilant because this new mutant spreads are more contagious. So if it's more contagious, that means more people are going to get it and then more people are going to die. So you have to protect yourself. You have to stay home. I know it's hard, but we got to do it. Look, we've all lost friends. We've all lost family members. Do you want to live with the guilt that you went out and brought the COVID back to your whole family? Several of them died. That is happening. So you don't want to be that. You don't want to be that problem. If you think you were exposed, tell your family members and quarantine yourself in your room with your mask to make sure that your family members are not getting the COVID. So you have to be honest about it because this kills. And I don't want you to live with that thought that, oh, because I went out and brought it back, now I lost several members in my household. Okay? Don't gather. The announcement went out for people not to fly, not to go gather up with family members. And what happened? People did. Several family members are dying. So come on, you guys, take this serious. Love your family enough to see them later. There's Zoom, there's FaceTime, there's all kind of different platforms where you can gather and see each other safely, virtually, without exposing each other. Okay, that's what we got to do. We have to do that. So in the meantime, if you want to tell your friends and family to watch my show, tell them to go to healthyliving.company and watch the show. You can watch it anytime. It will be posted there. If you are a Facebook fan, you will be able to see it there. They can watch the show anytime. So have them watch the show, and then I'll be able to tell them what they need to do for their safety. If you need to contact me, you can contact me there. Leave me a message. You can also contact me at the Next Level Studios here, 310-549-1113, 310-549-1113. And the producer of the show is T-Jams, that's T-J-A-M-Z. And you can reach him at tjamsmusic.com. All the songs you hear are his original creation. You can write lyrics there. He's also a web designer. Send him a message on the web. You can contact contact him here at the Next Level Studios, 310-549-1113, 310-549-1113. Now, it's a real number. It's not fake. It's a real number. So, until I see you in, a couple of weeks or so, if it's a little delayed, there's some technical problems, but remember what I said and stay safe. Don't go out unless you have to. Wear your mask. Get you some goggles for eye protection, because it is proof that it enters into the eye. I have prior shows where I talked about that. Stay as far apart as you can to stay safe. Wash your hands frequently. You can buy gloves as well. And I'll see you in about 2 weeks. So stay safe, stay healthy, eat healthy, and I'll see you then. Okay, see you in a couple of weeks. Don't forget to exercise. That's all part of your health as well. I'll talk to you in a couple of weeks. Okay, bye-bye.